The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Lacey Castilleja Fisher. She is a licensed professional counselor, supervisor, registered play therapist supervisor, and a certified perinatal mental health clinician. She founded Open Heart Counseling of Austin, PLLC. It's a small practice in Austin, Texas. And she became passionate about working with parents that struggle with PMADS, especially PTSD, after her own experience with becoming a mother and experiencing trauma when her newborn was unexpectedly admitted into the NICU. This led her to learning as much as she could about perinatal trauma, pregnancy and infant loss, NICU trauma, and fertility struggles. She served as the clinical director of the Pregnancy and Postpartum Health Alliance of Texas, which is now Nurtured Texas. We actually have an episode with them as well. If you haven't listened to it, you should go back and listen to it. And she loves teaching other clinicians about reproductive mental health. So thank you so much for being here with us today, Lacey.
Yeah, thank you for having me.
Yeah, so I am really excited to talk about this because we've been talking about fertility. We're in our fertility series, and they can really be a very emotionally complex time. Anytime you're going through this perinatal period, it can be emotionally complex, but some people don't think about, if you're struggling to get pregnant, the added struggle of that. So what are some of the most common mental health challenges you see people face during that time?
So yeah, that there's so many things that can come up for someone. And I'll start with saying there's anxiety, depression, and trauma that can come out of it. So the main things I think I see are the anxiety. It's just always thinking about it. People feel completely consumed with, is this going to be the month? Is this going to happen? What do I need to do differently? Trying to get in with the fertility specialist. Some people, are waiting for their OBs to refer them to over. And I tell them, you can make an appointment with a reproductive endocrinologist and go ahead and get that path started just to see what your options are. But the constant worry, and people feel like, I can't hope for this. I will be let down. I've been let down so many times before. So they always have this cautious optimism. Mm-hmm. And, I think the thought that they have, most people say, is, if I set the bar low, then I, can be prepared for the disappointment, or I can handle it better. And it's still really
low
hard
expectation.
Yeah.
But you can say you have a low expectation, but really deep down inside you don't, because I dealt with a very short-term fertility situation, and it was taking me way longer to get pregnant than I thought it should at 23 years old. I was like, I thought I would get pregnant so fast, And even that short period of time, it's interesting too, because the gaslighting that feels like it's being done to you when you're struggling with fertility, you're like, okay, maybe I am crazy. You feel like people are like, it's okay, it takes a while to get pregnant. But it can be 1 month or 2 months of trying not get pregnant, and you can still have some anxiety, let alone if it's years and years. So how can someone begin to care for their mental health when fertility starts to feel all consuming or uncertain? What are some suggestions of things to do?
Yeah, I find most people find good support in Facebook groups, like support groups. And there's one for the Austin area. People go on there all the time asking, hey, how did you cope with this? Or who are the best doctors? Or who did you feel most comfortable with? Who are counselors? And counselors that have extra training in fertility mental health or mental health related to fertility is very important, so that people feel like they don't have to explain the different procedures that they're going through. It
Mm.
just makes it a little bit
Like they don't
easier.
have to educate the
Yeah.
person that they're talking to. Yeah. I find
Yeah.
even with regular pregnancy, like somebody that just is struggling with mental health through regular pregnancy and postpartum, if it's not someone that specifies in that, it's again, it feels like you're explaining everything before you can even get help. And so, yeah, having somebody that's specifically for fertility and understands what all of those procedures
Yeah.
are is helpful for sure.
Yeah. And other ways that I think, balance it outside of going to a counselor if you're not ready for that or not able to, is just selecting events to attend, um, and not completely withdrawing. Because when we think back to the mental health struggles, when we go to the possible depression category, it's it can look like people withdrawing from their friends, because it is really hard to be around certain friends and pregnancy announcements or people that are having newborns. So people will step back from that. And this really messes with people's identity, because they had this idea that they were going to be a parent at some point, and when they're ready, when that turns on, it is hard to turn off, and that's all someone really wants. And to have to go through all these procedures and thinking how much it's going to cost if it gets to that route, it just is makes sense that some people step back because it's too hard. So some friendships
Yeah.
may be put on hold, and
Yeah.
that's okay.
I actually, one of my biggest pet peeves is someone asking someone else, when are you guys going to have babies? Because
Mm,
you don't know that they haven't already been trying for so long. I have a silly little business TikTok that I do, or like not business TikTok, but about birthy things. And one of
mhm.
the rants I went on was, it is not your business. Like, do not ask people questions about when they're adding on, because you may have secondary infertility. Like,
Yeah.
when are you going to have another?
Yeah.
Or when are you guys having kids? We went to somebody's wedding one time, and I think it was in 2021, I believe. And at the wedding, it said that their motto was baby free till 2023, because people kept asking, when are you going to have a baby? When are you going to have a baby? And no one knew behind the scenes that she had something that
Mhm.
she was dealing with, that she may never be able to have kids. But that was
Right.
like her way of mitigating people asking,
Just
like
mhm.
pretending like she doesn't want kids right now.
Right.
And that's so painful too. So there's often a lot of shame and isolation tied to those fertility struggles, especially like guilt too. Like, it's my body or the partner's body, and they're feeling like it's their fault. So, how do you help them process those emotions and help them feel less alone?
Right. So first of all, it's just validating. I let people know when they come in what you're experiencing, thinking, feeling is completely common and valid. And it will take time to feel differently, because this is so incredibly hard to cope with. It's unpredictable, it's uncertain, and like it can't be fixed right away, if at all. And I
Right.
think that's a lot of people go into fix it mode and say things like, just relax or give it time, and
It's
or it's
okay,
not
it'll
meant to be right
happen.
now. Yeah. And that is just it doesn't validate, it minimizes what someone's going through.
Mhm.
So I help them see, especially so many people struggle with, I feel jealous or I feel envious. And I let them know that is totally okay. That is something that comes up. And I do this where I'm like, let's do it, call it the jealousy iceberg, where I might write down picture of an iceberg and put jealousy at the top. And then under the surface, I'm like, what else is in there? And help them think about what's there is longing, desire, grief, loss, isolation, despair, hopelessness, all those things are there. And that's what's really, driving that. So it's not an ill intention or wanting bad things for other people. It's just your grief and sadness is more in the forefront, more present. It's hard to see anything else beyond that.
Well, I love that example, because I remember a long time ago in therapy, I was dealing with somebody in my life that was always angry. And the therapist was like, anger is just a coding it's like the default for every other emotion because they're unable to be vulnerable enough to tell you about the other ones. So anger is what you get.
Mhm.
And that was really powerful to hear. And so it's kind of like the same thing, but jealousy.
Yeah.
Jealousy is just the coating, and there's so much underneath, or the iceberg. And it's just so much underneath. That's really helpful. And I think that's probably very validating for them to go, okay, I'm not a bad person.
Yeah.
Because those
Yeah.
pregnancy announcements, I think, are the hardest part. And having family around you or friends that are surprise pregnant or like weren't even trying and got pregnant. We've had
Yes.
clients who talk to us about worrying about telling their sister-in-law, or like nobody in their family knows yet because they don't want their sister-in-law to know, or their sister to know, or their cousin to know, because that person has struggled for so long. And then the person who's pregnant feels guilty about being pregnant because they love that other person so much. And so it kind of goes both ways, not as strongly though, obviously.
Yeah,
But that's
it's
interesting.
hard on all people, definitely the harder for the person going
Of
through
course.
it, but it's like and then we can help people find ways to communicate that. Like I know that this, you may be holding back because you're afraid that it'll hurt my feelings, but holding back or feeling like a secret also doesn't help either. Some people are like, I know it's going to hurt if you tell me you're pregnant, but honestly, it's better that I know.
Yeah.
And then, right, I can help people find all sorts of ways to have those conversations, to just cope with that. Cause yeah, there's no fix it. There's no
No.
easy way,
And
but
so I think we talked a little bit about boundaries. I mean, maybe that's a boundary too. And you were talking about like not being isolated and going to those parties or whatever. Do you have any other ways that boundaries play into protecting mental health during fertility treatments or trying to conceive?
yeah, limiting, you're trying to preserve your mental health as much as you can and limiting social events. So again, if it say a lot of times it's baby showers, people are like, I
Ugh.
feel really, really bad. I feel guilty, but I just don't think I can do it. So I explain that this is a boundary that's okay to have because I think it sucks for the person either way. If they do go or they don't go, they're going to feel bad.
Mhm.
But in order for them to say, this is just really hard. I can't right now, but I'm happy for you. Lets them know. I think it helps them say, I'm advocating for myself, that it is valid for me to be able to have that boundary and not feel bad about it. Again, it goes back into some friendships just may be put on pause for a little bit, and then they may come back around. Sometimes they don't, and that
Yeah.
hurts, right? So I think it's
Yeah.
just letting people know that, if they feel that they're forever changed by what they're going through, they are. And sometimes friendships forever change too.
Yeah, gosh, that is hard because it's like they feel guilty for not doing the thing, but also I think there's so much power in no. Just in anything in life, it's such a good lesson for all of us to just be able to say no and let it be a complete sentence and not always feel like you have to explain yourself. And the people around you that love you know what you're going through, and they should be able to deduce why you're not going or, whatever. But even like you're going to hurt either way. You're going to hurt if you go to the baby shower. You're going to hurt if you don't go to the baby shower. So do what feels less hurtful for you,
Right.
which is not inundating yourself for 3 hours with a bunch of people talking about a dang baby, or
Yeah.
looking at a bunch of pregnant bellies.
Right.
Prioritizing yourself in that and not putting everybody else first all the time. I feel like as a culture, we tend to do that.
Right. And that's totally okay for us to take care of ourselves. Like, cause you
Yes.
have to have the mental health, uh, it's so hard to stay positive in these situations. And if that is what it takes for you to preserve yourself, then that's totally fine.
Yeah. What about partners? How can partners
Oh,
support each other? Because
yeah.
it's not just the person trying to get pregnant, it's also the partner that can sometimes be affected, but also they're trying to help manage their partner's emotions. So, when they're experiencing this journey in different ways, what are some of those ways they can do that?
just, I think, talking as much as you can and trying to hold compassion and curiosity for each other, trying to refrain from as much judgment as possible, which is hard. We're human. We do that. But, definitely there's going to be different perspectives of the person who is going through more of the fertility treatments on their body. There's a lot more to take in. I mean, sometimes these procedures, they're very invasive and they can be traumatic for people. So I think that if you get to a point where it is just hard to hold compassion and you just find yourself not feeling much empathy, or we're totally on different pages, even before that starts to happen, you can reach out to a couples counselor that specializes in this, and they can help you see each other's perspective, give you both chances to speak. And then you have that person there that's holding space for both of you and kind of facilitating, really getting at the root of what the other person's experiencing, so that can help bring back some of that compassion and
I think
curiosity
that's
for
so
each other.
important too, because I think that sometimes this fertility thing pulls couples away from each other more
Yeah.
than it puts them together. And
Yeah.
one of the people is feeling guilty because they think it's their body, that it's their fault.
Yeah.
And then the person that it is their body, they're worried that the other person's not going to love them as much, and all of these things because they can't produce a child for them. And
Yeah.
it's so deep.
It is.
It's really, really, really hard. Is there anything that you wish more people knew or understood about the mental health and emotional impact of fertility?
That the grief is real. The sense of hopelessness is real. I was talking about identity before. Some people really do lose themselves as they knew it. And that can be hard for others on the outside to understand, even their partners. And I have so many clients that say, I never had anxiety in my life. And then I start with fertility struggles and all these treatments. And what if IVF, or should I do IVF? Can we afford it? All those things that they're like, all of a sudden now I'm anxious all the time.
Yeah.
And the anxiety doesn't go away in pregnancy just because someone's
No.
pregnant. Pregnancy after infertility is such a fragile time that people is still, they're used to that. I'm going to be let down. I'm going to be disappointed. So I cannot, it's almost like they're saying, I'll jinx it if I plan on having this baby. So
Same
some
thing with
people don't
pregnancy
even say
after
they're
loss.
pregnant. Yes. Oh,
Yeah.
big.
I mean,
big
I
part of
had a
what I do
miscarriage
too.
and I had never even had anxiety through my pregnancy before. And then when I had a miscarriage, I mean, the whole pregnancy, I
Yeah.
was nervous. And I remember my mom even was like, I can't just wait until he's on the outside and we can look at him
Right.
breathe. It impacts more than just the couple too. It's the family. So
Yeah.
it's so true. Like that fertility struggle of it does not stop just because you got pregnant. You're waiting for the other shoe to drop all the time.
All the time. Yeah. And, if I don't plan on it, then maybe I won't be as disappointed. And I work with people through that. Like they know they were going to be just as devastated. So then I can try to help them when they're ready. This doesn't happen all the time right away, but when they're ready, finding ways to embrace what's happening in the moment, that they are pregnant, that what they know right now in this moment is, I'm pregnant. This could work, and trying to take it day by day, which is really hard. Pregnancy is a long time, right?
So
And
long. I mean,
oh,
short and long, right? But when you're
yes,
waiting every day for the one day that the baby comes out, it's long.
it feels like minute to minute sometimes, and that can be like torture for someone sitting with that much anxiety and fear. So even people won't tell others that they're going through fertility treatments or that they're about to have a transfer, because they get people like, how did it go? Are you pregnant yet? And they maybe feel that excitement that others may have, that they're not ready. They're like, I'm not at that level yet. I'm not at that excitement. I want to be, but I'm terrified to be. So, yeah, that's all the things that come with it. It's
Yeah.
so hard. And
And
the
I think,
biggest thing, oh, sorry.
no,
The,
you go.
the biggest thing I think is that, again, it's not your friends not being happy for you. It's just really hard for them to.
I think it's hard for people who haven't gone through something like this to understand grief in relation to fertility, because usually people think of grief or mourning as losing something you had And this is losing the idea, like the possibility. So it's a little bit different in that, somebody who's never even conceived before, yes, there's a lot of loss that can happen in fertility struggles, but some people never even get pregnant the first time. And so the people are like, how are they grieving or mourning? Those words seem weird because you never had it. But you're grieving the concept, you're grieving the possibility.
Yeah.
And it's funny how, even couples that have been together for a really long time and have solid marriages, there becomes this, like, not every person in the couple has the same outlook on how hard we should try or how long we should try.
Right.
And I have a friend who just told me that she was going through IUI treatments and her husband thinks she only went through 4 of them, but she went through 9 of them.
Oh, wow.
She did 5 of them without him even knowing because he thought, like, this is silly. Like, let's be done. And she's like, I'm not
She
done.
wasn't done
And she
yet.
just wanted to keep going. And she was like, and then I kind of like gambling, like I spent enough money to go, okay, it's just not going to happen,
Right.
But, and then they may find out later that they had something else health-wise going on that they never knew about, which adds in like this whole other piece, which is what happened to her. She ended up finding out about a medical situation after spending all of that money. So there's also this like not only disappointment, but sometimes regret in trying, like so many different emotions.
And people do that. That's that when we take on the guilt and shame that comes, even though it's like not deserved guilt, it always is, what did I do wrong, or what should I have done differently, or I should have known that. If I would have done that differently, then we would be in a different position. So, and I think with the partners, that's another thing you can talk about in counseling is, what are the next steps and why are you feeling that this is the way you want to go, and why are you feeling hesitant to that? And that's something that we do. I do, and I have some other therapists that do, because it's a delicate process and there are a lot of emotions with it. And like you said, that sometimes people feel like they're drifting apart because of it. And, we want to help them feel like they're still on a team and that, this is possible. And
I've even seen it go forward further than that. Like they already have the baby, the kid's growing older, and they still are dealing with anxiety in parenting. Like we know somebody who ended up adopting, and their adopted children, like they're always living in fight or flight of what if something happens to them. And they're teenagers now, but I can still see them being ultra protective all the time. And she was like, but they're my babies. Like she still held on to that. And you can see that she never worked through the therapy part is so huge. And some people don't think about getting therapy for something like fertility. They think of marriage problems or they think of work problems. But when it's something that's internal within your body, they're like, well, if I had diabetes, I wouldn't be getting therapy. So why am I getting therapy for infertility? But it's like, there's so much mental component that goes along with this.
Because when you go back to, we're talking about the losses that some people don't classify as a loss, or it's hard for them to understand. I am helping people understand, like you do have, so these are what are kind of the secondary losses, is that the timeline of when you thought you would be a parent, financial. Sometimes it comes with spiritual and religious loss, because it's very confusing for someone's faith that can happen for a lot of people. Being able to say, we're just going to go on vacation or do these things because I don't know, I may have to have an egg retrieval. And, so the timelines in so many ways get thrown off. So that's what also people are grieving. There is a loss. And then when people go through an egg retrieval and they're thinking about how many embryos are going to form, and some of those embryos don't make it all the way, that's a loss, right?
Yes.
That's an idea of like, oh, this could be this my child and it didn't make it. Or you could say you get 3 embryos and then you try several transfers and then you're down to 1 embryo. And that's very scary, because then people know, usually sometimes it's like, what is the sex of that embryo? Mm-hmm. So then there's, oh, I might have a little girl. I might have
more connection to it.
Yes, you get more attachment that starts. So there's so much to grieve in that.
So to wrap it up, is there any advice that you would give a friend or family member of someone that is going through fertility struggles? Because a lot of the people listening may not have had their own struggles. This series may have not seemed very applicable to them, but how can they be a good support system?
I think it's checking in, asking the person what is going to be best for you. And you may get an answer like, I don't even know. Oftentimes the people I work with are like, I don't know exactly what I need, because sometimes I need check-in, but then I need people to, back off because it feels invasive. But I think it's just trying your best to say, I'm here for whatever you need, and I understand if you can't make this event. I want to still let you know about these things I have going on, but I realize that may be hurtful. So, I mean, honestly, what feels like it's going to be best for you?
Giving
And
them
just,
that out, like
yeah,
the permission to say no, even though you don't need permission to say no, but the preemptive understanding that
yes,
they may not want to go and that you're totally okay with that. You're not going to hurt my feelings.
yeah. And then I'm open to talk, and maybe just saying like, I know I may not get it right all the time, but I'm willing to learn. And you can do that on your own too, not always expecting that person to teach you. But so there are good Instagram accounts, Facebook groups where you can listen to the stories of people that are going through it, and then what they're saying, apply that to your friend. Like,
Well, it's funny
oh,
because,
they're saying don't do this. Okay.
yeah. Well, it's funny too, because this applies to every situation, right? Not just fertility. Like being a good friend, being a good family member, that could be in every situation. That is
Yeah.
the best way to be, is the preemptive understanding and being an open human that is going to be able to be a supportive friend or family member.
Yeah.
This has been so helpful. I know I'll put it in the show notes too, but do you want to tell everyone there where they could find you?
Yeah. Open Heart Counseling of Austin is my Instagram. And if you want to just search Open Heart Counseling, ATX.com, that you can see my services, my practice, and then the people. We have several clinicians that we specialize in all things reproductive mental health.
And is it all in person or is there a virtual option?
We have both.
Cool.
We're in Southwest Austin, and we do virtual options for people all over the state.
Oh, I love that. Okay. Thank you so much for being with us today, Lacey. This was really great.
Thank you.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.